What causes bleeding after sex? Many people with vaginas experience vaginal bleeding after sex at one time or another. Up to 63% of postmenopausal people may experience vaginal dryness and vaginal bleeding or spotting during sex. Additionally, up to 9% of menstruating people experience postcoital, after sex, bleeding. Occasional light bleeding is usually not a cause for concern. If you have certain risk factors or have gone through menopause, bleeding after intercourse may warrant a visit to the doctor. Causes of bleeding after sex. Bleeding after sex is medically known as postcoital bleeding. It occurs in people of all ages. In younger people who haven't reached menopause, the source of the bleeding is usually the cervix. In those who have gone through menopause, the source of the bleeding is more varied. It can be from the cervix, uterus, labia, urethra. In terms of causes, cervical cancer is the greatest concern. This is especially true for postmenopausal people. However, postcoital bleeding is most likely caused by a common condition: vaginal dryness. Vaginal dryness can lead to bleeding. In addition to the genitourinary syndrome of menopause, GSM, other factors can cause vaginal dryness, such as having intercourse before being fully aroused, friction during intercourse, douching, chemicals in feminine hygiene products, laundry detergents, and pools, breastfeeding, childbirth. Certain medications, including cold medication, asthma medications, some antidepressants, and anti-estrogen drugs, having your ovaries removed, chemotherapy and radiation therapy. Infections. Some infections can cause inflammation of the tissues in the vagina, which may lead to bleeding. These can include pelvic inflammatory disease, PID, an infection of the reproductive organs in the lower abdomen, which includes the fallopian tubes, ovaries, cervix, and uterus. Sexually transmitted infection, STI, such as chlamydia cervicitis, which is inflammation of the cervix that occurs as the result of an infection. Vulvovaginitis, which is inflammation of the vulva and vagina that often occurs due to an infection. Cervical ectropion. Cervical ectropion is considered benign or not harmful. It occurs when the cell type that typically grows on the inside of the cervix grows on the outside instead. Cervical ectropion may result in an inflamed area. Also known as cervical ectopy or cervical aversion, this condition is caused by high estrogen levels. Estrogen is the hormone responsible for regulating your reproductive system. However, it is considered a natural variant and tends to occur in adolescents, pregnant people, people using hormonal contraception, people who menstruate. Genitourinary syndrome of menopause, GSM. GSM was formerly known as vaginal atrophy. It is common in those in perimenopause and menopause and those who've had their ovaries removed. As you get older, especially when your menstrual periods stop, your body produces less estrogen. Lower estrogen levels also reduce the elasticity of your vagina. Vaginal tissues become more fragile, get less blood flow, and are more susceptible to tearing and irritation. This can lead to discomfort, pain, and bleeding during sex. Vaginal tearing. Sex, especially vigorous sex, can cause small cuts or scrapes to the vagina. This is more likely to happen if you have vaginal dryness due to menopause, breastfeeding, or other factors. Cancer. Irregular vaginal bleeding, including bleeding after sex, is a common symptom of cervical or vaginal cancer. Postmenopausal bleeding can also be a symptom of uterine cancer. Are you at greater risk of bleeding after sex? You may be at greater risk of postcoital bleeding if you have cervical or uterine cancer, are in perimenopause, menopause, or are postmenopausal, recently had a baby, or are breastfeeding, aren't fully aroused before intercourse, douche frequently, when to see a doctor. You should also consult with a doctor if you have any of the following symptoms: vaginal itching or burning, stinging or burning sensation when urinating, painful intercourse, heavy bleeding, severe abdominal pain, lower back pain, nausea or vomiting, unusual vaginal discharge. Treatment. Lubricants. If your bleeding is due to vaginal dryness, vaginal moisturizers may help. Applied regularly, these products are absorbed by the walls of the vagina. They increase moisture and help restore the natural acidity of the vagina. Vaginal lubricants also reduce uncomfortable friction during intercourse. Estrogen therapy. If your vaginal dryness is caused by menopause or the removal of your ovaries, talk with a doctor about estrogen therapy. Topical estrogen products include vaginal estrogen creams and suppositories. Another option is an estrogen ring. This is a flexible ring that's inserted in the vagina. It releases a low dose of estrogen for 90 days. Oral hormone therapy, which replaces the hormones estrogen and progestin, can be another option for some. Talk with a doctor about the risks and benefits of this treatment.